Sir?
Welcome to the New Hampshire Bureau of EMS High Performance CPR training. This online training will give you and your EMS team tools to improve sudden cardiac arrest survival in your community. You may be asking yourself, why does this matter? Cardiac arrest accounts for less than 1% of EMS calls, and the chances of survival are slim. But sudden cardiac arrest is the leading cause of mortality in industrialized nations. It kills more Americans than AIDS, lung, breast, and prostate cancer combined, and accounts for approximately 350,000 deaths a year. That's one every 90 seconds. Although overall survival rates in the United States are poor at less than 10%, high-performance systems have ventricular fibrillation and ventricular tachycardia survival rates of over 50%. Survival rates may also serve as a benchmark for overall system performance. It is time-critical and time-dependent, involves multiple EMS skills, requires teamwork on the scene, requires coordination with other stakeholders, the care and outcome are measurable, and EMS has a strong influence on that outcome. If you do cardiac arrest well, you will likely succeed in other time-critical illnesses such as STEMI, stroke, sepsis, and trauma. Creating a successful cardiac arrest system of care is not complicated, but it's not easy. There are many links in the chain for survival. It takes a system to save a victim. This training will focus on a very important link: high-performance CPR. Change begins locally. You can make a difference and work within your community to strengthen the chain of survival and save lives. This is what we want to see when we arrive on the scene of a cardiac arrest. Unfortunately, this is what we often see. One barrier to bystander CPR is the reluctance to perform mouth-to-mouth ventilations. In addition to bystander reluctance to perform mouth-to-mouth ventilations, it's also been shown that it takes a significant amount of time to ventilate patients, approximately 16 seconds for a layperson and 10 seconds for a paramedic. Click on the button below to listen to Dr. Kudenchuk explain the importance of compressions and how that affects pressure within the cardiovascular system of your patients.
So what are the essential components of CPR? Well, we can divide it into two phases, compression and decompression. And the point to remember is when we press on the chest, it's not just the heart we're trying to squeeze blood out of. It's the entire chest that becomes the pumping chamber by which CPR is effective. Compression, when we press on the chest, increases intrathoracic pressure. That ejects blood not only from the heart, but from the lungs and vessels and every component inside the chest, which means good compression empties the chest, increases forward output, and provides a blood pressure. In the decompression phase is where we allow the chest, the pump, to recoil. That recoil decreases intrathoracic pressure. In fact, it creates a vacuum inside the chest, and that vacuum is what refills the heart and lungs, which means the better the recoil, the stronger the vacuum, the better the refilling, and a heart that's more refilled will be ready for the next compression to provide even a better forward output.
Let's take a look at some important points to managing cardiac arrest patients. Chest compression fraction is an independent predictor of mortality. Chest compression fraction is the percentage of time you're doing chest compressions during CPR. When using high-performance CPR, this should be at least 80% of the time. Push fast, but not too fast. The optimal compression rate should be between 100 and 120 compressions per minute. 110 per minute is the sweet spot. The optimal depth should be between 2 to 2.4 inches. As Dr. Kudenchuk reminds us, leaning increases intrathoracic pressure, decreases blood return to the heart, and subsequently results in decreased coronary and cerebral perfusion pressures. Ensuring complete recoil during chest compressions is critical. Limiting pre-shock pauses is also a critical part of successful resuscitation. One important study found an 18% decrease to hospital discharge for every 5-second pre-shock pause. The take-home point of this is to perform chest compressions while the defibrillator is charging and get right back on the chest immediately following the shock. Now let's talk on how we can put evidence into practice. Often when EMS teams arrive on the scene, they gather equipment first. For a cardiac arrest, depending on your crew configuration, consider sending in a provider without equipment to initiate compressions. Clear some space to optimize your working environment. Move furniture or get the patient into a position that will allow rescuers space to kneel on both sides. Make sure that there is sufficient room at the head and resuscitate the patient as close to the scene as operationally feasible. While not everyone in ventricular fibrillation lives, high-performance EMS systems have a ventricular fibrillation survival rate of greater than 50%. If providers have the mindset that the patient will survive, they will work harder to save the life and not give up easily. Cardiac arrest is a BLS event. There is no evidence that ALS interventions improve outcomes. While ALS providers have an important role, ALS providers should work around the BLS team. ALS interventions should be performed without interrupting compressions.
Hi, ma'am. Concord Fire Department. What happened? Okay, I'll take over from here, hon.
I heard him fall.
Yep.
And
I
I
guess.
just started to do compressions.
Okay. All right, Jeff, what do you got? Okay.
Start compressions, good CPR.
Bob, you getting the oxygen?
Yep. You want airway in real quick?
Sneak around the side of you, Jeff. Okay, guys. On 3, bring your hands to mine. 1, 2, 3. Back on. Okay, on 3, bring your hands to my hands. 1.
High-performance CPR really focuses on the things that improve patient outcomes. These are minimally interrupted chest compressions, appropriate chest compression depth, rate with appropriate recoil, and controlled ventilations. Really, BLS providers own CPR now. In the past, I think there was a focus on doing things other than CPR. We used to stop chest compressions to, say, perform airway management, give drugs, put in an IV. All of those things don't improve outcomes, so really high-performance CPR focuses on what matters most. It's good basic life support skills. Basically, we know that hyperventilation kills patients. If you overventilate a patient, you're increasing intrathoracic pressure, and by increasing intrathoracic pressure, you're decreasing blood return to the heart and the thoracic cavity, and decreasing perfusion to the brain and the heart.
If you witness the arrest, push right arrow.
8, 9, 10. 8, 9, 10. 8, 9, 10.